So normal pH of blood. So average pH of blood. So in this, option A 7.20, option B 7.30, option C 7.40, and option D 7.50. So average pH is answer 7.40. If it is asked range of pH of blood, then it is 7.35 to 7.45. Second one, veins carry dash blood. A. Oxygenated. B. Deoxygenated. So veins carry deoxygenated blood. Remember, arteries carry oxygenated blood. But here one more thing you need to remember. Pulmonary veins carry oxygenated blood, whereas pulmonary arteries carry deoxygenated blood. So it will be opposite in case of pulmonary veins and arteries. Coming to third one, total amount of blood present in human body. Option A 3 liters, option B 4 liters, option C 5 liters, and option D 6 liters. So total amount is 5 liters. So it can be range from 4 liters to 5 liters. Coming to fourth one, albumin, globulin and fibrinogen are synthesized in option A kidney, option B liver, option C lungs, and option D heart. And the answer is liver. Coming to fifth one, normal albumin to globulin ratio is 1 is to 2, 2 is to 1, 3 is to 4 or 4 is to 3. And the answer is 2 is to 1. Coming to sixth one, normal count of RBC 3.5 to 4.5, 4.5 to 5.5, 5.5 to 6.5 and 6.5 to 7.5 million per cubic millimeter, and the answer is 4.5 to 5.5 million per cubic millimeter. So I have previous video of normal values, so you can see all the normal values of blood in that video. Lifespan of RBC, it is a repeated question every time. 110 days, 120 days, 130 days or 140 days, and the answer is 120 days. Eighth one, formation of RBCs is called A. Hemopoiesis, B. Erythropoiesis, C. Monocytopoiesis, and D. Granulocytopoiesis. So formation of RBC, here don't confuse, it is erythropoiesis. Hemopoiesis is where formation of all the blood cells, whereas formation of RBCs are erythropoiesis. Next one, lack or absence of intrinsic factor leads to which vitamin deficiency? A. Vitamin B3, B. Vitamin B5, C. Vitamin B7, and D. Vitamin B12. And the answer is vitamin B12. Vitamin B12 is also called as extrinsic factor. So when we are taking food from outside, so in the form of vitamin B12, then if there is absence of intrinsic factor, then it can lead to vitamin B12 deficiency. During blood transfusion, blood is stored at a temperature of 1 degree Celsius, 2 degrees Celsius, 3 degrees Celsius or 4 degrees Celsius. Answer is 4 degrees Celsius. Coming to next question, the type of nucleus present in neutrophils. A. Unilobed, B. Bilobed, C. Multilobed, and D. None of the above. And the answer is nucleus present in neutrophils. So it is multilobed, because another like basophils, it will be bilobed, and monocytes, it will be different lobes. So next question, increase in eosinophilia occurs in which type of fever? A. Typhoid, B. Malaria, C. Scarlet, and D. Dengue. So increase in eosinophilia occurs in scarlet fever as well as hay fever. Next one, increase in basophils occurs in acute leukemia, chronic leukemia, acute myeloid leukemia, or chronic myeloid leukemia. And the answer is chronic myeloid leukemia. Next, kidney shaped nucleus is seen in A. Lymphocytes, B. Thrombocytes, C. Monocytes, D. Erythrocytes. So kidney shaped nucleus is seen in monocytes. Next, B lymphocytes are responsible for active immunity, passive immunity, humoral immunity and cell mediated immunity. And the answer is humoral immunity. T lymphocytes are responsible for active immunity, passive immunity, humoral immunity and cell mediated immunity. So answer is cell mediated immunity. So B lymphocytes humoral, T lymphocytes cell mediated immunity. Next one, type of anemia caused by vitamin B12 deficiency. A. Iron deficiency anemia. B. Megaloblastic anemia. C. Aplastic anemia. D. Hemolytic anemia. So, vitamin B12 deficiency, it is megaloblastic anemia. Lack of function of bone marrow leads to which type of anemia? So, lack of function of bone marrow. So, hemolytic anemia. B. Iron deficiency anemia. C. Megaloblastic anemia. D. Aplastic anemia. So, answer is aplastic anemia. Increase in the RBCs in the blood is termed as A. Leukopenia, B. Thrombocytopenia, C. Polycythemia, D. Thalassemia. And the answer is polycythemia. Next one, vitamin K is synthesized by A. Kidney, B. Intestinal bacterial flora, C. Gastric mucosa and D. Pancreas. And the answer is intestinal bacterial flora. Next one, hemophilia A is due to deficiency of factor 5, factor 7, factor 8, factor 9. And the answer is factor 8. And we have blood clotting factors total 13. So those are the factors. Next, hemophilia B is due to deficiency of same factor 5, factor 7, factor 8 and factor 9. It is due to factor 9. So hemophilia A factor 8, hemophilia B factor 9. Platelets have lifespan of 1 to 2 days, 7 to 10 days, 30 days, 40 days. So platelets will be having only 7 to 10 days, whereas RBC 120 days. Red cells in iron deficiency anemia are normocytic, hyperchromic, microcytic, macrocytic. So the answer is microcytic. Iron deficiency, so micro. Graveyard of RBC, that is destruction of RBC, happens where? A. Pancreas, B. Liver, C. Spleen and D. Bone marrow. And the answer is spleen. So these are the important MCQs. So any question can be repeated. And there are important points you can see here. First one, iron is absorbed in ferrous state, whereas iron is stored in the form of ferritin. So there is a difference. It is absorbed in ferrous state and it is stored in the form of ferritin. Next one is milk is a poor source of iron. Next, normal specific gravity of blood is 1.060. Hematocrit definition, it is the percentage by volume of red blood cells in blood. Next one, RBCs are formed from pluripotent stem cells of red bone marrow. Next one, ABO blood group system obeys Landsteiner's law. Next, for blood transfusion, blood is stored with ACD mixture, that is anticoagulant citrate dextrose mixture. Next one, in thrombocytopenia, bleeding time is prolonged and clotting time remains normal. So that is thrombocytopenia, decreased platelet count. Then in hemophilia, clotting time is prolonged and bleeding time remains normal. So keep these bits in mind. So please subscribe my channel for the upcoming videos. In the upcoming videos, I'll be uploading about all the anatomy topics unit wise.